My name's Carrie Lynn. I'm a knowledge mobilization specialist with CIPCERT. I was just reading the land acknowledgement and realized I was muted the entire time. So it is with gratitude that we offer this land acknowledgement as a small part of an ongoing conversation towards reconciliation. We do this to reaffirm our commitment and responsibility in honoring relationships between nations and improving our own understanding of local Indigenous peoples and their culture. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the First Nations, Inuit, and Métis peoples that call this nation home. Please join us in considering how we can each, in our own way, move forward in the spirit of reconciliation and collaboration. So today we have a great talk for you, animal-assisted therapy for public safety personnel, mental health, and well-being. Some quick housekeeping notes before we get started. All attendees are in listen-only mode to limit background noise, and your cameras will remain off. Today's session is being recorded and will be sent to you one day after the webinar. Please use the question box to submit your questions throughout the webinar, and we'll try to answer as many as possible. And this event will be presented in English with the option of simultaneous captions or audio in French. So please use the link that will be posted in the chat. This will enable you to log into Wordly, which is our translation platform. Please be sure to select French in the top right corner and keep the window open throughout the talk today. So please join me in welcoming Freya and John Tyler from the Building Academic Retention Through Canines, or BARC program at the University of British Columbia's Okanagan campus. So I'll hand it over to you. I'll stop sharing and you guys can share your slides.
Thank you, Carrie Lynn. And just to start, a thank you to CIPCERT for this invitation to share our work. And I'm John Tyler Binfed and co-presenting with Freya Green from the BARC office and a doctoral student at UBC. And the title of today's talk is Dogs in the Detachment, Improving Law Enforcement Wellbeing Through a Canine-Assisted Intervention. I'll say at the outset, we're presenting in French, mais à la fin, vous pouvez poser des questions en français. Donc, ça peut être un peu bilingue vers la fin, quoi. Okay, we'll carry forward, Freya. Just a quick overview of today's webinar. If we scaffold this, we'll give you just a brief background and kind of situate the context of the work we do at UBC. And then we'll look at some of the factors that impact law enforcement well-being. And then Freya is going to do a deep dive into two studies we've done at the local RCMP detachment. And then I'll pick things back up and we'll look at, sort of cast an eye to the future to see what's being done in the field of particularly dog interactions within law enforcement contexts. Who we are. Well, I'm a researcher, a professor at the University of British Columbia in the Okanagan School of Education, and I'm the founder and the director of the program that Carrie Lynn introduced, BARC, Building Academic Retention Through Canines. Though we're predominantly an on-campus program, we do community service work too, and we'll tell you about that. And I'll throw things over to Freya, who has a unique connection to the law enforcement field.
Good morning. Yep, my name is Freya Green. I am the program coordinator of the BARC program and a doctoral student at UBCO. I'm here today really because I find this work meaningful, and I think we all have to do work that we find meaningful. I'm inspired daily by the members that I meet on Thursday mornings, but I'm really inspired by my family. I come here from a long line of public safety personnel. I have lifeguard, search and rescue, police, correctional staff, medical staff, all in my immediate family. I've experienced firsthand what that looks like as a family member, and we've experienced a lot of loss. So know today that I find this incredibly meaningful and humbling to do this work.
We'll just pause that for a second, Freya. I want audience members that you're on this call, I want you to envision or conjure up the idea of CPR, somebody giving CPR. And today we're really in for some emotional CPR. So let's watch this video. An officer goes down with a heart attack. Watch how he checks the pulse here, right? And we can move forward from there. But that sets a tone for today. We're in for some emotional CPR, and and uh, we'll see if that comes to fruition in the work we share. Next slide. All right, so any of the information we share, really, you can find out more about us at our website, and our website is really a repository of all the work that we undertake, and we compile all our kind of achievements or deliverable outcomes in an annual report. And so last year's report is available, as are all the other years, and we're in year 14, wrapping up year 14 now. But the website is there as a repository of information for folks who are keen to learn more about what we do. The origins, people always ask me, well, how did this start? So as an academic, I came from Southern California up to Canada to work, and I brought a therapy dog. I was involved in just community service work, and this dog here, Frances, who's now 15, she and I worked in a residential treatment facility for adolescents with acquired and traumatic brain injury. And so that was my sort of initiation into this. And when I came up to Canada, I brought Frances to campus with me regularly. I'd go across campus to get coffee, and it would always be the same choreography. I'd be besieged by students, and they'd largely ignore me. And they'd eventually look up with these tear-filled eyes and they'd say, as much as I miss my parents, I miss my dog more. And so there was that kind of catalyst right there that was the impetus for me to start this program, to increase opportunities or create opportunities for people to interact with dogs. And so that's the origin of the BARC program. Your stress level is high. Follow me to the lab. But Frey and I are really, really fortunate. We pursue joy in the research that we undertake. And this is our work environment. It's 30 square meters, and we operate a group socialization model. So we have multiple, up to 15 dogs working in the same space at the same time. We serve a large proportion of the UBC campus community, and then we'll tell you about some of the off-campus in-community work that we do. We thought we'd show you just a really quick video, and I want you to pay attention to this notion of the dogs as social glue, connecting people who otherwise might not be connected. We'll just watch this quickly. You know, this video is sort of a cute animated video, but it really at the core illustrates this power that the dogs have to connect people who otherwise would remain unconnected. And we've seen this repeatedly after 8 years at the Kelowna detachment, and Frey will tell you about some of the good work she's doing there, where people who otherwise wouldn't be connected have their guard sort of softened or their threshold lowered to allow these kind of interactions to happen. We chose these photos here because I want to illustrate the good work these dogs do. The dogs, you could not substitute humans where the dogs are and get the same affective reaction, the same sort of emotional reaction. And the dogs are really this conduit or quick facilitator to human emotion. And so we see that repeatedly in the work we do. We ask a lot of questions, research questions in the BARC office, and this is a bit of a flex and some, showing off some of the publications we do. And we'll tell you about 2 publications in particular as we move forward. I want to just briefly touch on a line of research we've done that's garnered some attention. We know that spending time with therapy dogs, interacting with therapy dogs, is beneficial for human well-being. It boosts well-being around joviality, connection to others, sense of life satisfaction. And then it decreases correspondingly ill-being, stress, loneliness, sense of social isolation. And so we wanted to find out, well, we know that it's beneficial, but we didn't know why. And other scientists around the world didn't know why. And so we assigned participants to one of three conditions, either a 20-minute hands-on touch condition, they had to touch the dog, 20 minutes where they could be near the dog but not touch the dog, and then a no dog control condition. And we found that touch was optimal in eliciting well-being. So if you have an opportunity and you're listening to this and thinking about designing a program or implementing something or working with a local agency, make sure that touch is available, that you encourage participants who come to sessions to put hands-on touch on dogs. Then we extended it further. And last year we did a study that's just getting published now, where, if you can imagine, it sounds a little silly, but we trifurcated 100-centimeter long golden retrievers to rear, middle, and front end, because we wanted to find out, does it matter where you touch a dog? Do you get more if you're at the front, or you get more at the tail wagging at the back end? And what we really found was you get a little slightly more benefit from the front end, but really it's marginal in nature, and that it doesn't matter where you interact with the dog, that we see the benefit. So that's the nature of the research that we're doing, is kind of drilling down into finding out, well, what is it about the dogs that contributes to human well-being? Freya and I can't take any of the credit for all the work that we do in Bark. It's really the heavy lifting is done by these dogs. We work with a couple agencies in town, and we work with Pause It Forward Rescue, which is a local Kelowna rescue agency. And so many of our dogs come from there. We do have lots of golden retrievers as well, and labs and doodles and all sorts of hounds. But they do the heavy lifting, and they live with their families in the community and come for protocols once or twice a week. These dogs are really, we ask a lot of them. So if you think of helping dogs, and there are service dogs, guide dogs, hearing dogs, emotional support dogs that support one person, but therapy dogs are unique in so much that they support a variety of clients, including law enforcement clients, in a variety of different contexts, some of them very complex. And so we ask a lot of these dogs. And so the assessment of the dogs that we do in-house at UBC, we assess and train all the dogs ourselves. And that has worked out well over the last 14 years, and we currently have over 70 dog handler teams working for us. I've mentioned this a couple of times, alluded to this already. We are primarily on the campus, but we're also in the community. And so we have run previously a Boys and Girls Club for kind of at-risk youth. And then we've done senior programs and school programs for social emotional well-being. And then, of course, Freya's project, the Kelowna RCMP, that we'll tell you about. The impetus for this, or the origins of this, really came from, we've gone through 4 superintendents, but Brent Mundell was our superintendent, and he had heard of our program on campus, and unbeknownst to us, he came out and just observed. And then he set an appointment with us. And it was interesting because we had dogs at the appointment. I think we were near the Starbucks cafeteria, and we were just constantly interrupted by students. And he said, if this works, a quarter well of what I'm seeing happening, it's going to be a hit. And so then we did presentations to the watch commanders, captains, and kind of convinced them on board. But it took this leadership to integrate the program. And Freya will talk about how it's integrated. It's not an add-on. It's built within the day-to-day kind of programming for folks. And but that senior management support around well-being was critical to getting us launched. And we're now in year 8. One thing that I want to just kind of highlight at the outset is that if you were to undertake anything like this, and Freya and I were sort of the pioneers in this years back, it will garner ample press. That we certainly have seen that, and people around the world really have reached out asking for, well, how did you do it, and what are some of the protocols to implement that? So rest assured, if you're looking to sort of garner good press, having dogs integrated into the building is one way to do that. I think it's my turn to turn over to Freya. Is that right?
Is, yeah.
Okay.
So thank you. I'm not going to bang home too much about this because occupational stress is something that the majority of you are probably living with. But as we are going to talk about this quite a bit, I do just want to provide a quick definition just in case, which is the total amount of negative psychological responses that workers experience during job performance. Now, we see that this is split largely into two categories. We have our operational, or what we call the job content stressors. This is your sort of traumatic events, negative interactions with public, heavy workload, the sort of the content of the job. We also have the organizational stresses. So this is sort of job context. So within the environment you're working. So this could be agency politics, this could be insufficient rewards, the culture, discrimination, things like that. So this will come up a little bit later. What we know from the research, many of you will have done this yourself, is that the consequences of occupational stress are pretty bleak. It increases your risk of compromised mental or physical health, maladaptive coping mechanisms such as substance abuse, drinking, gambling, social isolation, familial issues, and ultimately your ability to serve the public or perform your job. I don't want to focus on too much today because I want to get onto the dog things, but I do just want to highlight this article here by Carlton and a lot of other colleagues who are really doing important work in the area that looked at public safety personnel in Canada and found there were 5,813 surveyed. So this is a robust sample. And they found that the public service personnel were 4 times more likely to screen positive for a mental health disorder than a member of the public. And we were looking specifically to RCMP for this purpose of the study. They found that half of RCMP either screened positive for or disclosed a mental health disorder, which meant they were higher than any other public safety personnel. That's nice and depressing for you, I'm afraid. Onto a slightly more positive note, I am primarily a canine-assisted intervention researcher, so my job is to bring dogs and people together and to look at the impact that has on people. What we know is that spending time with therapy dogs and their handlers has the real potential to reduce stress. This is in a variety of contexts, whether it's pediatric care, psychiatric care, schools, universities, hospitals, you name it. But what hadn't yet been done when we started this project was to look at the stress reduction benefits within first responders or public safety personnel. Now, I confess this is now an older study, just because we're looking back in time as to what we were inspired by before we did our work. And really, we had to turn to sort of veterans and military contexts and work that service dogs were doing. Now, I'm not by any stretch saying that veterans are the same as public safety personnel, but this really was the closest we could get. This was the closest that had been done thus far in terms of looking at occupational stress. So we conducted kind of a 2-phase model. Phase 1 was really to see, kind of to dip our toes in the water and see if this was even possible. So we ran a pilot study, which for those researchers amongst you was a pre-post test design. In English, what that basically means is that we have members attending sessions. As they arrived, they completed a very brief form to come in. That was mainly things like demographics, but also asked for their current stress level and a word to describe their work environment. They then spent time with the therapy dogs and handlers for as long or as little as they wanted to do so. We did not have any manipulation of that. And then when they left, they did a brief post-test, which again was just the stress and the work environment. So this was primarily a quantitative study, so numbers-based, but with a few open-ended questions to learn a little bit more. Now, I do just want to say that we didn't just dive in and go, yeah, we'll just take a therapy dog in and see what happens. There was a lot of homework that we had to do. And for those looking at doing this, I recommend to make some notes here. We did have to get RCMP approval from head office, as well as university human and animal ethics. But once all that was sorted, we then did quite a bit of homework to make sure that we could make this a success. So first, we selected handler dog teams based on suitability for the detachment. And that was a bit of a challenge for us because we didn't really know what we were going into either. But we selected handlers that were arguably a little bit more mature, kind of very level-headed, could handle sort of the unique environment, potentially unpredictable environment, and things like dark humor that they may kind of ultimately experience, and dogs that were particularly solid, dogs that were unfazed by changes, unfazed by noise, sort of even more so than our regular therapy dogs. Once we'd done that, we obtained advanced security clearance for all members of the team. This has to be renewed every 3 years. So this is a bit of a hoop, but we've worked really well with the team at the RCMP, and this has been relatively easy for us. We then had a handler training on protocol for clients in distress. We acknowledged that the situation we're dealing with in a detachment is going to be very different to that in a university setting. So we wanted to make sure that was clear. And then we were very fortunate that 2 RCMP members led a handler orientation within the detachment to allow them to see the space and allow them to prepare their dogs accordingly. And the dogs were then introduced to the space and the nuances of law enforcement setting. Again, given that most of these dogs work primarily on a college campus, we wanted to give them the opportunity to experience the new sights, the new scents, the new noises, the nuances that you're not going to have within the college sample. And now during sessions, and this continues to happen, we are escorted into and out of the building and accompanied at all times by an RCMP liaison. This includes going to the washroom, everything. We are always under the watchful eye. And we do kind of complete ongoing monitoring of canine wellbeing. So we have 2 members of the team who are certified animal-assisted intervention specialists who monitor the dog's wellbeing at all times for stress and just general enjoyment. Over the 8 years that we've been doing this, we have had no instance of compromised canine or human welfare. And yet we have had little hiccups. I think the most notable one, and I do have a video, but I can't share it publicly. We had a major alarm go off at one point during one of our sessions. All the resources were directed to a specific area of the building. This quite loud, disturbing alarm. I'm sure many of you have experienced this was going off. I think the humans were a little bit affected by it. I think I was probably the most distressed by it, but the dogs could not have cared less. They were amazing. I have a video of this alarm blaring and they're all just lying on the floor. I think the only thing they noticed was that the people that were petting them had disappeared. So we do have an especially solid team here, which I'm very grateful for. So back to the sort of phase 1, really we wanted to kind of work out, would members actually make use of this? It's all very well us introducing this resource, but would people come? In short answer, yes, we had 251 employee visits by 120 unique employees. 56% of these were by members, 43 by civic employees, so pretty 50-50. 66% of visits were made by women. This is perhaps unusual in the law enforcement literature, but not especially unusual for therapy dog literature. We had an average attendance of 31, and typically people spend about 11 minutes. One of the concerns that had been raised was, would people kind of take the piss out of this, and would they stay for the full 90 minutes while they should be working? This was not supposed to be a break for them. This was integrated into their work time. But we found that employees basically made it a 10-minute coffee break and often reported that this was replacing their coffee break. So that was really sort of sufficient for them and also realistic within the working day. To give you a little bit of context in terms of the detachment, there were at the time 375 total employees, so 32% roughly made use of the program, which is equivalent to what we see on college samples as well.
Freya, it merits noting too that we provided coffee and treats to folks at the station. So we really engendered that notion of, hey, come take a break from the workday and chat with the handlers and visit the dogs and your fellow colleagues too within that kind of supportive context.
Yes, we do. And initially, I would say that a lot were coming for the coffee, but these days they tend to take a coffee when they leave now. So it's definitely less of a focus now, but it's definitely an added perk to the session. I don't want to bore anyone too much with numbers, but a quick and easy answer to the question, does this reduce stress is yes. I just want to point out the chart here. You can see I've circled 1 on the pre-test and the post-test. This was this level of sort of not at all stressed. We see that on the pre-test, this block 4 is really significant. It's really high. That is the stress. And then we see this general downward trend after the session, even after only 11 minutes, to be significantly lower in stress. We also asked them, as you may recall, to describe their workplace environment in a single word. And to determine whether that was positive, negative, or neutral. This was really interesting. Even after 10 minutes, these words were changing. I'll point out the RCMP one here on the left, the pre-test. We saw incoming stress was number 2. It was very high. And then on post-test, that completely disappeared. We did see a couple of stress, but it didn't make the top 5. So that was really interesting to us, that even in that short time, it's actually changing the language that people would use, and thereby changing sort of the workplace environment, or increased morale. So phase 2, having conducted the dip the toes in the water project, we wanted to go in and just examine things a little bit more deeply. This time we went in with interviews. So we interviewed 8 full-time members, 75% of whom are women, to really get a sense of, tell us more. What worked, what didn't work, why did it work, as well as the context in which they were working. So again, these were hour-long interviews with a lot of data. So for the sake of time, I'm going to reduce things to kind of the key takeaways. So one of the questions was, what are their perceptions and experiences of stress within the workplace? Unsurprisingly, organizational stresses were more commonly reported than operational. We had 49% of the stresses identified were organizational. So that's that job context side of things. Members reported that exercise, getting perspective, and social opportunities were key coping mechanisms for them. We were pleasantly surprised that they identified a lot of sources of support and a lot of potential resources, but they also identified a lot of barriers to seeking this help. The big 4 were stigma, whether that was self-perceived or other, and whether it was sort of actual or anticipated. Time, or the lack of it. Accessibility, that was both physical in terms of I have to drive somewhere to get this resource, or I have to go somewhere to do this, or even just this sense of, it's only available Monday to Friday, 9 to 5, and that doesn't work with my work schedule. And finally, trust concerns. Is this legit? Is this really confidential? Am I going to find out that someone's said something somewhere else, and that this will get out to my colleagues?
Let's just stay here for a minute, Freya. Can you speak to the role of the watch commander or captain, I'm not sure of the language, you know that better than I do, around kind of setting a tone around stigmatization? Can you speak to that?
Absolutely, thank you. So the watch commander, we have 4 watches in the Kelowna detachment, and we have definitely noticed a difference in attendance and general attitude towards the program based on the watch commander. We can actually predict, based on who's on or who was commanding, how many people we're going to get roughly, whether it's going to be a busy session or a quiet session. And really what we've learned and what we've been told is that their attitude sets the stage for everyone else. If the watch commander is not even necessarily negative, but just sort of flippant about the program or about wellbeing resources in general, members feel shy or unable to attend because they're very aware that they're always being watched by the commander. Whereas the watch commanders who are positive, and particularly those who attend themselves, we see a lot more uptake of the program and just generally more positive attitudes towards the program from those watch commanders, staff members. So the next question we asked was, do they gain anything from it? And if so, what? It was overwhelmingly yes. Members were very supportive of the program, very supportive of having it within the detachment, and very supportive of the benefits that they achieve. The big 5 here were 87.5% of members described it as a break from work or a chance to recharge, refresh. People described it as like a welcome relief. We also saw stress relief being a big one, 75%. Same with change perspective, which was this better sense of reality. And I included this example below just because it really captured that one, which was that a member described BARC as a safe place that ends up giving you the energy to go back and do stuff you need to do, but with more clarity of thought and a different motivation, which I thought was lovely. We also had the sense of, I really enjoy it, and improved mood. So I found myself smiling even after the session, or I'm happier. And members talked about reliving the experience and thinking about it later in the day and feeling happier again later on too. Now, this one wasn't one of the big codes from the prevalence point of view, so we didn't see this mentioned a lot, but this one really resonated with me, and I wanted to include it because I think if you're planning something like this is something you need to hear. So one member said, what I also really liked about the program and what I got from it was I felt like our senior management was doing something, actionable, that was a gesture of caring about their people. And later said that they believe it just shifts a culture a little bit for them, and that it restores people's faith in their management, that they actually care.
Freya, can you just stay there for a second and talk about the importance of integrating the program within the workday versus having it as outsourced that requires an appointment or travel?
Absolutely. So these sessions are within the detachment, inside the bounds, and during regular shifts. They're often at sort of handover periods as well. We did this deliberately to reduce the barriers. And we really heard from members that it does make that difference, because they don't have to, and we saw that being a barrier, they don't have to go, they don't have to schedule, they don't have to pre-plan any of these things, and that they can just have this spontaneous, oh, the dogs are here, and walk over, a 2-minute walk from their desk, and come and say hello. And I think too, having the support of senior management, that it's not considered off time, and getting reminders that this is part of your work, this is build time, this is not your break, this is not your personal time, go and do this, go and invest in yourself. I think made a massive difference, not only in terms of how people felt about it, but in terms of the actual uptake.
I think it's important to also recognize too, Freya, that we argue on campus that the reduction in stress helps, and you've alluded to this, helps people think more clearly kind of about their well-being, and then what steps they might take to access other resources within the detachment to as needed, because we recognize this is not a full-on fix. This is called an adjunct or complementary source of well-being support. So we're not, for example, fixing PTSD after a problematic call, but we are providing temporary relief that helps the client or the visitor sort of recalibrate their thinking around seeking outside support. I don't know if you have anything to add to that.
No, just that it can be that conduit to sometimes recognizing the need, but also seeking more formalized support. So often members, they'll be talking to our handlers, and they'll say, yeah, I actually hadn't realized quite how stressed I was. Maybe I should do a session, or maybe I should go and see my counselor, or maybe I should talk to my peer about that or something. It does often ignite that thinking to then go and seek more support.
Yeah.
Having said that they found it impactful, we were really keen to kind of learn a little bit more about sort of how and why. This was before we did our touch study, actually, and we really were trying to unpack the sense of what is it that they do? Why does this work? The biggest one, and this ultimately inspired us to do the physical touch study, was that members reported this tactile physical connection with the dog as being impactful. So they talked about physically petting, or the texture of the dog, or the sense of like a warm hug. They also talked about the characteristics of the dog. So this was sort of them being cute, loving, affectionate, adorable, them having little personality quirks, and them being non-judgmental. They talked about how they're unconditionally loving. They don't care what I say or, what I look like. They're just here to be. And that was something they found impactful. One that sat with me too, and came up quite a lot, was the sense of contrast between the session and the work environment. So participants described the bark session almost as like a microclimate, or like a bubble of joy, and reported that they were often coming from something stressful, something negative, whether that was a call out, whether that was paperwork, whether that was just a rough meeting, and the sense of like, I walk almost into this wall of positivity. It's calm, it's quiet, there's laughter, it's positive. It's a very different, almost shockingly different space even within the detachment, and that was something that participants really resonated with in terms of changing their perspective.
Great. Can I ask, I know on campus the students will develop favorites, and you would have had repeat visitors like we do on campus. Did any of the members was that evident to you that they had favorites and sought out certain dogs?
Absolutely. Possibly slightly less explicitly than the students. I think the students are a little more shameless about it in some ways, but we've had members who have been visiting us for 8 years, and they will ask in advance, oh, is so-and-so here today? Is Kit going to be there? Can I? And they will make an effort to make sure all the dogs feel loved. Is definitely something that they do. They'll visit all of them, but they do absolutely have favorites, and the dogs have their favorites too. Certain people walk into the room and the dogs just light up and they light up, and it's really interesting for me to see that physical change. We're now located in a space where members come in, and they'll come in kind of visibly quite stressed or grumpy or just tired, and then they see the dog, and you see these members who just sort of melt onto the ground, and they're not afraid to lie on the floor and cuddle. I have many memories of members of literally lying on the floor with the dog's paws on their chest and things like this, and that's a really big contrast to everything else within the detachment.
Well, let's just dive a bit deeper there, Freya, because we know the dogs they're assessed for their disposition, this calm nature. And what we really want is for the dog to invite the visitor, the client, to join their level. We don't want the dog to match the level of the client. So if the client is agitated and stressed and high energy, we don't want the dog to all of a sudden pick that up. We want the dog to invite the client to join that calm, relaxed state. And we see evidence of that repeatedly over time.
Absolutely. And I think a lot of that is sort of we're very aware of that purely in just body language. The dogs are deliberately very relaxed, and they'll solicit attention through eye contact and tail wagging, but they're not jumping up, or they're not sort of being like very extroverted. They're very calm about it, and then that really invites the client to come and actually sit down or lie down on the floor with them, and sit on a comfortable mat or a comfortable chair and just take a minute.
Yeah.
Absolutely. In terms of implications of the two studies we just talked about, this really taught us a lot about CAIs in general, but also CAIs within a high stress environment. There was no literature yet on how this could work within the police context, and we also see this. It revealed itself as a low cost, low barrier, easy access, and low stigma workplace wellbeing initiative. And really, this challenges us and challenges all of us to ask the question of, if we're not doing something like this, what are we offering instead that ticks those boxes? What else can we offer that's low cost, low barrier, easy access? And that can be a real challenge. In terms of recommendations, I guess simply put, I really hope that this inspires other first responder environments to think about CAIs, but also to explore viable wellbeing resources for management level members. This is something that came out a bit in our interviews. Was there's a lot of resources out there at the moment that work for most members, but as soon as you become more senior, those peer-to-peer support networks, they become inappropriate. They no longer really work, because you've got these senior management level personnel. And this was something that we saw with the CAIs, is that hierarchy isn't there, because it could be a senior member, it could be a brand new member, and it doesn't matter, because it's that informal resource. So that's something else I challenge people to sort of think about too when designing these things. Now, I've talked about the two studies that we've done in the past. I do just want to talk about what we can call phase 3 for now, which is kind of where we're at the moment. We have been moved to a new high-profile space within the detachment. As Dr. Binfet mentioned earlier, we have been through 4 superintendents, and our most recent 2 have been exceptionally supportive, just as the first 2 were, in really trying to reduce these barriers. And so we're now on the first floor in a very high traffic spot, which has really reduced some of the barriers that people were finding to have to go upstairs to access this in a specific room. We've expanded our programming. We do satellite visits to sort of the mini detachments, sort of, but that were within the Kelowna, but in other areas. We've added therapy dog handler teams. We've added sessions that we do throughout the year. We've expanded the amount of time that we are in session during the year. We've just celebrated 8 years of partnership. We're now fully funded by the Kelowna detachment, which is fantastic. And in terms of will people continue to use it, I can share that from September to December last year, so the semester we've just finished, we had 508 visits, an average of 63 per session, which is more than double what we saw in the pilot program. So this continues to grow and continues to be something that people are utilizing.
It maybe mentions merit too, worth mentioning, Freya, that this started from a Social Sciences and Research Council grant from the government of Canada, who thought this was meritorious, that this well-being initiative in the detachment merited funding. And so we received 2 years of funding from that grant. And then over time, the detachment picked up the tab, which we would say is nominal, sort of a maintenance fee to have this um, continue in the detachment. But it started from a grant, ample support, and then lots of support for the research component to say, does this work? And then once that was tested too, then they carried forward. But hats off to you for 8 years of running programming like this. That just doesn't happen every day in complex environments too.
Absolutely. We've been really lucky too with the news and media coverage. We work very hard, and particularly Dr. Minfet works very hard on media, and we've had fantastic coverage. As we said, you do something like this, people are going to pick up on it. Not only has that been fantastic for spreading the word and inspiring others and getting this further out there, but it's also been really interesting to change the narrative. When we were conducting these studies, it was particularly bleak in terms of media coverage for police. It wasn't a pleasant time, as I don't think it really is now. And what we noticed is that this was really changing the narrative and changing the way that public perceive police. It was changing the story into a much more positive story. And we got a lot of traction on these and a lot of really positive responses to the work we were doing. I'm going to leave this up briefly. This will be in the recording, so it'll be available afterwards. But this is just the QR codes for the two research studies. So you've got phase 1 on the left, phase 2 on the right. For those of you who want to get some more information, some more details, all the statistics and things like that. So those are both available online. And I will now pass back to Dr. Minfet to talk about sort of where we're at in terms of new research.
We've got just a few minutes before we open up the chat to questions, but we wanted to cast an eye to the future, and we looked at some of the publications that cited our own work and the studies that Freya ran in the precinct, the Kelowna detachment. And really, we see, a variety of iterations of therapy dogs and law enforcement integrating or mixing the impact of therapy dogs on perceptions of police officers. We'll tell you about that. Bridging campus police and campus community with therapy dogs. So this idea of, again, changing the perception, that social catalyst of the dogs, evaluating facility dogs. We work with therapy dogs, so facility dogs are a different sort of cup of tea, where they have a handler and are assigned to that person who facilitates interactions within a workspace. And then again, facility dog programmatic effects on individual well-being in high stress environments. So this idea, again, of research attesting to the role of dogs within the work setting to optimize well-being. So we'll just talk briefly. I'll just share this first study here. This is a study out of the University of Arizona, and they really wanted to examine the perception, or shifting the perception of law enforcement, here police officers, with or without a therapy dog. So they had 473 participants in this study, and they asked them to rate officers, and these are real life photos of officers with or without a dog. And they looked at they asked people about the approachability of the officer, trustworthiness, comfort, agreeableness, friendliness, sort of factors that impact interactions between the public and members of the force. And then they gave them a perceptions of police scale, kind of a formal psychometric scale, to look at their 12 items on a 5-point Likert scale, to say to what extent do you agree or disagree with the following. I like police, for example. And really, just to wrap up, we see significant findings. They're not huge, but they are favorable in the direction of optimizing the perception of police when a dog is present. I think the question, and this is one we could certainly discuss, is, well, where would this be applicable? Where would you ever find a police officer with a therapy dog, because they're so, historically connected to police dogs that we're to stay away from? And it really would be in community policing, I feel, especially in programs in schools, especially in programs in after school programs or in community center context. So this research, I think, is sort of pointing in the direction of leveraging the benefits of having that dog and letting the dog do the heavy work of kind of connecting the public to the member. So this we're on time here, and we invite you to ask questions now. Vous pouvez poser des questions en français. Il n'y a pas de souci. And if you have any concerns or questions about what we presented, you certainly can look find out more information about the BARC program at our website. You can follow us on social media. We have a robust social media presence, especially Instagram. And then we'll open up the floor. And I think Carrie Lynn is going to moderate the questions. But we want to thank you for your attention and for joining us today.
Thank you both. That was great. Very great. Do you know of any other programs across Canada that might be doing something similar? And are other first responders kind of welcome and included in this as well? I know we spoke a lot about police, but of course there are other sectors and things, and they're probably in our audience. So
Right. We certainly hear about them. And I know that the Colleen Dell, Dr. Dell at the University of Saskatchewan, she does work with first responders and works with St. John's ambulance dogs. So these are outsourced dogs, and she does a variety of different programming related to that. So um, her lab is one of, along with our lab, we're the only two labs in Canada that are doing this sort of work, really. But Frey would know kind of, I don't know who else is out. We hear from Ottawa quite a bit, and we hear from other folks.
Yeah, and I know that Vancouver Police Department, VPD, have a facility dog through the PADS program. PADS Puma is one of the facility dogs that assists with the VPD.
great. Thank you. One of our audience members is asking, I wonder if you could share more about the selection of dogs and dog handlers. Were there dog trainers or other experts involved in selection? Are there any established dog handler training programs you can recommend, or do you feel there's a need for such training programs?
Yeah, I'll address this, Carrie Lynn. We, for the last 14 years, have done in-house programming, and that is because we wanted full sort of governance over the kind of dogs and handlers that we have working in the program. I want to just highlight this point that one dog misbehavior, for example, inter-dog aggression, would shut down our program, right? Inappropriate behavior by a handler in public, these kinds of things. So we're very, very careful. And what we do is a gradated onboarding of new teams. We start just with the handler. And if the handler, he themselves is not suitable, or there's questions we have about that, then we just stop right there before we even see dogs. Then we invite them to a series of interviews, and we do a number of mock stations or trainings. And one of the things Frey and I have found really beneficial is we do the entire team, and there can be up to 30 people on this, vote on every dog and every handler for acceptance into the program. And it might surprise listeners to hear this, that oftentimes the dog will pass and the handler won't pass. So it's that unique combination of the handler and dog together that renders them suitable. Then we put them on probation and we onboard them over time to build capacity. And we really have to have handlers who are open to correction. So if we don't like the leash length, or we don't like how they're navigating public spaces, we stop them in the moment and we have them redo it. It's that ongoing formative assessment that has done really well. And then it's not until they're finished their internship, their probationary period with us, that they're fully onboarded. And then we do further refinement. And this speaks to today's talk. Like, we have school programs. So not all dog handlers and dogs are well suited for young children. And so we have some that work in schools, and then the same with the RCMP. And Frey can speak to some of the considerations for RCMP handlers.
Yeah, agreed. And I mean, the team we have working on the assessment, like Dr. Pippin said, is more than 30, including we have certified animal assisted intervention specialists, we have dog trainers, service dog trainers, people with years of experience as therapy dog handlers, and people with sort of more specialized experience in the different areas that we work with. So we do have school teachers helping with those
Counselors.
things, counselors, etc. In terms of the RCMP dogs, yeah, we do have a very small sub team. So we have over 70 handlers in the team. We have 8 that do the RCMP. Primarily, I mean, partly because of capacity, partly because we don't want all 70 coming into the detachment with security clearances, but also it takes a very special kind of dog and handler to be suitable for this work. I mean, you're facing things you're not going to face in other places. I mean, members are coming in with guns that have been recently fired, right? And so for the dogs, they can smell that. They can smell the difference in that. So dogs have to be kind of okay with that. They have to be okay with the big vests, with radios, with, you know, potentially big uniforms, big backpacks. We see a lot, you know, potentially evidence boxes, wheelie carts. We get it all. And so selecting a dog that's going to be completely okay with that takes a very special kind, and a lot of exposure and just testing. How do they react to things? How do they react to that? And the same with the handler. You know, if the handler is going to react to something, then the dog's more likely to react. That stress travels down the leash. And so you need a very particular pairing that will work for a context like this.
And we often look for what's called a high startle reflex. It just takes a lot to set the dog off, right? And so that's often a key indicator of you know, in our assessments, they're kind of, we throw a lot of stimuli at them and we're doing the assessments, and the dog's like, just no, a non-reaction, really. So that gives us confidence that they'll be able to weather the stressors, if you will, or stimuli in the RCMP detachment.
Thank you. Are there any kind of best practices that you know of for tailoring animal assisted therapy or canine assisted therapy to the roles and the schedules of our public safety personnel and first responders?
Yeah, the shift work fair, you can maybe speak to that because not everybody has access.
Yeah, it is a challenge with the shift work, because we're asking community volunteers to volunteer. You know, many have families, many have children, and we're not going to be asking them to come in at 3 o'clock in the morning and do a stress reduction kind of program, which, you know, in an ideal world, that's what we do. We'd have it available all the time, but balancing the welfare of the dogs and the handlers is ultimately something we have to do. The way we do it is we actually run at a consistent time on a Thursday morning. And because our watch shifts over the course of the time, and we plan this intentionally in advance, that we do see each watch throughout the time. So typically we would see each watch twice in a single semester, so in a 3 or 4 month window. But also they are welcome to, and indeed some do, come in even off their shift. So they don't have to be working to access the program. And we have members that, you know, will plan the bark sessions, they'll have the dates, and they'll come in especially to seek that resource even on an off day.
Great. Yeah, and I mean, getting the word out about the program too, and especially doing things like this will help with that too, which is wonderful. Are there ways that organizations can incorporate this kind of therapy into their existing mental health and wellness programs?
Yeah. I think the starting point, Carrie Lynn, and for people who are on the call today, is to have a close look at the mission or vision statement of the organization. And that's always our starting point, to say, how can we help or assist the organization in meeting this deliverable? And then to have it embedded. And the reason that's important is if you get any pushback, and there usually is pushback, you can sort of counter that by saying, we're upholding the mission and vision of the organization to optimize the well-being of members within the work environment. And so that's how we have approached this on campus and in the community. And so know your mission and vision statement and see how the program possibly aligns with supporting that.
Yeah, we have a comment in the chat. We've got someone who's a handler for a PADS dog in the Yukon, and they're saying they work, excuse me, with EMS and other public safety personnel. They've been a team for about 1.5 years and have seen huge change in supporting public safety personnel and their mental health. So that's great. Thank you for your comment.
Well, we love to hear that because we know exactly this kind of experience, and it would be this feedback, and it's this affective thing. And you know what it really, and the person who's from the Yukon, I know you would relate to this. It would be a look from a member. That's all it would be. It would be a look from somebody who just says, Thank you for what you're doing. Lovely, lovely kind of connections that happen. Yeah.
Mm.
So Frey and I are always kind of saying we're the luckiest folks because we get that repeated feedback from people saying, thank you for what you're doing. So if you're looking for a sort of joy-filled pursuit, those of you who have capacity to introduce something like this, it's really, really rewarding work.
Yeah, that's actually a great segue too. Thank you for your comment and your responses. Are there ways to make these kinds of programs more accessible in those more kind of rural or maybe lower resource settings, or areas that might need a little extra attention?
You've set us up, Carrie Lynn, because Frey and I, and along with Dr. Christine Tardif-Williams at Brock University have developed these virtual canine comfort modules. So this is this idea of providing, because we realize, if you're in a small rural detachment or operating and it's a two-member thing, you're not going to get these kind of services in your detachment. And so we offer really to connect kind of disenfranchised folks in rural areas, and we have these 5-minute long virtual canine comfort modules. They're available on our website, and they can just be accessed repeatedly as a way of kind of a brain break, right? To sort of recalibrate the thinking. And what we find from the research, and this is from a randomized controlled trial with over 1,000 participants, they work, but less effectively than the in-person. So in-person interaction is optimal, but the virtual still contributes to a reduction in stress. So again, those are available on our website, but virtual canine comfort is one pathway that addresses those hard to reach folks.
Great, thank you. Yeah, I've put your website up in the chat as well, so people, our audience members, can go there and look for that too. So
thank you.
Thank you. I'll just end with one final audience question here, and this may be a conversation for later, but someone has said, hi, I'm an RCMP member with a facility dog at NHQ in Ottawa, part of a pilot project. Can you tell me what Kelowna detachment funds for you?
How much are you asking? How much they pay annually? I think
I'm not
that's
sure. They're just asking, can you tell me what they fund for you? So again, yeah, maybe that's a conversation for another time, but
well, we can break it down this way. It covers all our sort of onboarding costs of handlers and dogs, vesting, identification of the team, that sort of thing, transport to and from site for, we have Freya's paid for her directorship of the program and for time delivery. I think one student researcher is paid as well on a weekly basis.
And then the handlers are volunteers. They don't get paid for their role, but there is a little bit in the budget for a thank you at the end of each year.
Yeah, an honorarium for the handlers who give their time. Yeah, so we're going to say it's under $5,000 a year to keep that program running on a weekly basis. And that's with the UBC infrastructure supporting that. If you're not without, a home base, it would be a different kind of situation, but that gives you a ballpark figure. So again, we really pitch this or describe it as a no cost or low cost, easy access, low stigmatized way of supporting the well-being of employees in the detachment.
That's amazing. Thank you. Thank you so much. We're running out of time. I'm just going to share a final slide that we have. It's just a thank you slide for everyone today and for our speakers. Thank you so much for doing this, taking free time to do this for us. We really work to kind of provide options for our first responders, and this is a unique and very, very great way to start off our 2026 year. So thank you so much. If anyone has any questions afterwards, you had made your emails available and they can contact us at CIPSERT as well. So thank you again. And that was amazing. Thank you.
Thanks for the invitation. We appreciated it. Have a good day, everybody.
Thank you.